Hey guys, what's up? It's me here, November Williamson. Welcome back to Island of Psychiatric Survivors Advocate. Today I have a video that I've been promising my YouTube peeps for a while now, which this actually, let me just tell you what the title is. It's all about my ECT treatments. I think a lot of people probably want to know about this. But fun fact, this was actually, I think, a podcast episode. Not sure if it got published or not, but today I'm going to be using my iPad and looking at the notes for it because it's easier to do it on here than on my laptop. So, this was a podcast. It might have been released. I'm not sure if it has or not. But if it has been released and my podcast is inactive, which I'm still debating on whether I want to restart it or not, just focus on YouTube. But anyway, so if you saw it, you saw it. If you heard it, you heard it. If you didn't, here you go. Okay, so it says podcast, but it's YouTube video. So it says, no, this podcast discusses things that may not be medically correct because my memory is shot around the time procedures were done. Please contact your medical professionals. This podcast is about my electroconvulsive therapy experience, also called ECT. I had it done at 17 years old, and usually they wait until someone's 18. But in Georgia law, you can have it 17 or 13 through 17 if 3 doctors say you need it done. I had mine at Summit Ridge Hospital in Lawrenceville, Georgia, and this is why I would not recommend. And while I would not recommend this hospital, the ECT staff were very good. However, this was in 2018, so this could have changed. Okay, so seen by the lovely intellect doctor that I will not name because I don't want to slander. Saw me in 2014, told me I was severely ill and had borderline personality disorder at 2014. Who later told me I didn't have it because I wasn't manipulative. Ironic. Anyways, I saw him in 2018 at April, and he diagnosed me with psychotic depression. We had already talked about ECT of my current psychiatrist, who said it wasn't do good to psychotic patients for it due to the confusion. The doctor restated that wasn't true, which wasn't hard to do with all the meds I'd bound, so I did it. I did it twice, first in April 2018, then in June. In June, the doctor diagnosed me with psychothymia, which is a mild form of bipolar, and we had the infamous moment where he said I wasn't psychotic because I can use an iPhone. I was the youngest to do it at Summit Ridge, and so they brought me to the ECT treatment center at Summit Ridge and showed me the video and gave me a literature on what ECT, which I still have. I'm using this to explain what ECT is. If you don't know what ECT is, here it goes. Basically, it's a procedure that uses electricity to treat severe mental illness. It's used as a last resort when the patients can't use or don't respond to meds or therapy. It can help pregnant women who can't take meds or someone severe risk to suicide. It causes chemical changes. It can also be used for bipolar or schizophrenia. It can also be used to treat Parkinson's. ECT is not used to punish patients, and it doesn't cause permanent memory loss either, although my long-term memory is shot. It does not cause brain damage either, and is not painful. They use general anesthesia. Most people have 6 weeks of 3 treatments a week. They don't use hard convulsions either. The movement is very mild and muscle relaxant is given. The prep is to talk to a healthcare provider and have a complete medical exam, and prep not by eating or drinking before the procedure because of general anesthesia. They are given informed consent and make follow-up appointments. During ECT, they give you anesthesia, muscle relaxant, and oxygen, and bite block. The first time they gave me the muscle relaxant, and I couldn't move or speak, and I could only hear. Then the anesthesia kicked in, and that didn't happen. It was very frightening, but it never happened again. Then electrodes are put in place to monitor the patient. I got bilateral ECT, and that is the kind that most patients get. This means it can be on both sides. Treatment is given and a controlled if current is given up to 1 second, and the seizures last to 30 to 60 seconds. After about 10 minutes, the patient wakes up and gives meds for headache and nausea. My ECT started inpatient both times and then outpatient. The side effects I experienced were confusion and headache. Severe memory loss is rare, and memory around the time of treatment was lost to me a few times. My side effects is I didn't have a headache or nausea really bad. I remember I had a light headache once. My biggest side effect is my long-term memory loss. There are whole trips that I went on that I can't remember, like I'll see photos of them, but they won't resonate with me. If I were asked to do ECT treatments again, I would say no because it didn't improve for me. I wasn't improved by them. My psychosis is improved, and so did my depression improve, but not long-term. I was looking to maintenance, but not right now. Another weird side effect is I get seizures at night, like mild seizures when I'm asleep. It doesn't happen often, but every once in a while I get convulsions in my sleep. only start after the ECT treatments. The ECT seems to be a good idea for some people, but personally it didn't work out. So I hope this answered some questions you might have about ECT, and if you're confused about what it is, just reach out, comment, message me on Instagram. All my stuff is isandofpsa. My link tree is linktr.ee/isandofpsa. Thank you guys so much for watching. Bye.